Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and welcome to my YouTube channel. If you are new to the channel, if you enjoyed the video, just make sure you hit like and subscribe so you can be updated on all the new posts that I create, all the videos I post. Alright, and hit the notification button. Alright, so in this video, I'm going to be talking about thoracic spine pain or mid-back pain. I like to get you oriented when I'm talking about things like this to increase your vocabulary and your understanding of how the body works. Alright, so this here is my spine model. The green part is the mid-back or the thoracic spine. Now this part of the spine is where your ribs connect to your spine. Alright, so here it consists of 12 vertebrae. Like all areas of the spine is made up pretty much of the same material. It's made up of the hard stuff, which is your bones. Two bones come together and creates a joint. The bones are connected by ligaments. Remember, the ligaments connect bone to bone. Tendons connect the muscles to the bone. In between each vertebrae is a disc. We call these spinal disc or intervertebral disc, and it's a spongy-like type of tissue. This is important for absorbing the forces that impact on the spine. So this helps you in terms of keeping your height and things of that nature. These things here, these yellow things, is the spinal nerves. The spinal nerve comes off of the spinal cord. The spinal cord is an extension of the brain, so it begins once it exits from the, we call that the foramen right here. Alright, now the mid-back pain, what causes it? One of the number one things is trauma or injury, such as if you fall, which will be macro trauma. Okay, micro trauma mean that it's something that's really big, so you fall, get in a car accident, you fight or something like that, somebody hit you with something or throw something at you, boom, direct injury to that area. It can also be caused by a micro trauma such as abnormal posture, which I've seen is one of really the second cause of the back pain, because a lot of us sit. Alright, we sit all day, we use computers, I use laptops, and as a result from us sitting for prolonged periods of times, we have a habit of slouching. Alright, so we'll start to go forward. I'm going to show you from the side. So you may start off like this. You may start off with your shoulders, with the ears over your shoulders, nice and tall, using a computer, and what happens over time is your head starts to go forward and your back starts to round, alright? And then you start to experience pain and discomfort. Now sitting for prolonged periods of time, so that could be 60 minutes or greater, will cause you to have some discomfort in this area, alright? Especially again, if you're using a computer for prolonged periods of time, if you're studying, if you are driving, alright, that can cause mid-back pain or thoracic spine pain, as well as if you have injury to your shoulder. And this is how chiropractors can help you, alright? If you have a shoulder pain or complaint, or if you had mid-back or thoracic spine pain, and this is why. Alright, like I said before, this is the area of your spine where your ribs connect to your spine, which is the mid-back or thoracic spine, 12 vertebrae. Alright, now this area, so this is if the spine was facing this way. Alright, now over here, I'll put a picture so you can see what I'm talking about. Over here you have your scapula or your shoulder blade. And these muscles that come off of the spine actually connect to the shoulder blade. So if you have a mid-back pain or problem and your muscles are tight, it can cause your shoulders to hurt as well as you have restricted range of motion with your shoulders, because muscles do a lot of things, but the two main things I tell people is that muscles generate energy, and muscles pull. All right, they do not push. If that makes sense. So when the muscles contract, they will pull the bones closer to the joints closer to each other, the bones closer to each other within a joint, if that makes sense. Again, I'll give you a visual so you can understand what I'm talking about. I know I'm talking kind of fast right now, but hopefully you'll get it. So if you have injury to your mid-back, that can cause restriction in your shoulder. If you have injury to your shoulder, that can cause you to have injury, restriction, or pain in your mid-back spine. How can chiropractors help you? As stated as always in previous videos, chiropractic care is a form of health care that emphasizes restoring and or maintaining your health through spinal adjustments. The goal of chiropractic care is to place your body in the best position so that it can heal naturally. All right, when chiropractors talk about removing nerve interference or removing interference from the body to the nervous system, what we're talking about with that is that when your joints are not moving well, you can see how the spinal nerve exits out of this area here, right? See that opening? All right, this is a joint. This is the area here because these two bones are coming together. This is a joint. Come on, look. Can you see it? Can you see it? All right. Now, if these joints don't move well, you will have fluid and edema that will accumulate in the area. If you ever had a sprained ankle or you ever injured your thumb or anything like that, I remember I joined the Marine Corps very briefly. All right, I went to Officer Candidate School. I did not complete it. I got injured. All right, I broke my finger. I broke my finger in a very unique way. I was doing the Tarzan swing and I broke my middle finger. All right, I had a hairline fracture, but I completed the course. All right, I completed the course, and what happened was, because my finger was injured, I couldn't move it. Why? Because there was swelling and edema in the area, and it was also bruised. My finger was purple. All right, now the same thing happened when you have an injury in your body. Same thing happened on the outside, what happened on the inside. It's sort of a bruising on the inside because it's the tearing of the tissues. As a result, when you touch it, it hurts, all right? So that's how you know this inflammation and fluid is in the area. Now, this inflammation and fluid has particles in it that actually irritate the nerves, and the nerves consist of a lot of pain receptors, as well as you have pain receptors in and around all of the tissues and structures in that joint. The pain receptors are important. Pain is important because it lets you know, hey, something is wrong, something is not right, go get some help, or you need to just relax, all right? So those substances that's in the fluid, the inflammation and edema, irritates the nerves. As a result, the nerves will become hyperactive, for lack of a better word, and it will cause the muscles to spasm or to contract, okay? So as a result, you'll get decreased range of motion. It will hurt when you move, all right? Now, removing interference to the nervous system through a chiropractic adjustment, what we do is we help mobilize the joints. If the joint is restricted, now because you have scar tissue that's around it, when we mobilize the joints, guess what? You're going to move better. We're breaking up scar tissue. And as you move, guess what? The fluid and edema is going to move out of the area, meaning the nerves are less irritated. So guess what you're going to perceive is less pain. So that's how chiropractic really work, the basic premises of it, all right? Like I said, chiropractic is going to help you from the TMJ joint all the way down to your big toe if you are feeling pain and discomfort. Now, if it's something that's beyond the muscles in the joints, if it's something that's very serious that's caused you a mid-back pain, such as your heart pain, you could get something what we call referral pain, meaning if you're having pain in other areas of your body, say in your heart and your lungs, you may experience back pain. All right, now if your back pain is not relieved through chiropractic care, through exercise, or any type of thing of that nature, then it may be a more serious issue that you may need to go see your MD for. All right. I love talking about anything related to health, all things related to health, really. If you like the video, please hit the like button. If you feel free to leave a comment down below. If there's any health topic that you would like for me to address, please put it down below and I will do my best to create a video for you. All right. And I think I covered everything. As always, if your pain does not improve within 5 days and you're eating and drinking medicine, whatever medicine you decide to use, go seek help. Seek the help of a licensed chiropractor. Go seek, if you don't want to do chiropractic, okay, I understand. A lot of people don't like it. Then go see your physical therapist, all right? Because they're going to teach you, as well as the chiropractor is going to teach you what to do to prevent you from having this pain again. Going to teach you how to strengthen those muscles. So then give you a rehab exercise program, okay? And teach you how to, what we call educating on activities of daily living in, which is going to help you to prevent you from hurting your body again, all right? So meaning if you're using a laptop computer, use it as a monitor and buy a keyboard, all right? So that'll prevent you from slouching forward. If you are driving or sitting for prolonged periods of time, take a break. You know, get up, walk around, set a time if you have to, whatever you need to do. Adopt your own exercise program where you're stretching. Do something that's low impact, such as swimming, running, do yoga, all right? Anything that gets your body moving. All right, so that's all I have for you today. As always, remember, a healthy mind and healthy body creates a healthy life. Until next time, stay healthy.